Well, I'm so excited to be here with Kathryn Coleman, and the first line that I needed to recognize in the introduction is that Kathryn is a longtime public servant, and on the long time, I have evidence of that because Kathryn and I overlapped when I worked at HHS during the Clinton administration. And HHS is so fortunate to have had her experience and expertise, and I'm able to speak firsthand of that because of the time that I was fortunate to overlap. Kathryn has been at CMS for 25 years, and she's currently the director of Medicare's Drug and Health Plan Contract Administration Group, and I know many of you have worked with her in that role as well as the other hats that she has worn at CMS, and we're so fortunate that the administrator had recommended that she come and speak, so she obviously comes highly recommended, and that she's also come from Baltimore to join us today. Previously, Kathryn served as the Associate Regional Administrator for Medicare Health Plan Operations, as well as Director of CMS's Region 7 Medicare Part D Outreach and Education Campaign, among any other roles. So we also couldn't be more fortunate as we just kicked off enrollment last week with CMS to have her here today. Prior to joining CMS, Kathryn, had an illustrious career also on Capitol Hill. She worked on the Senate side, and she spent time in the New Mexico State Senate. So please join me in welcoming Kathryn, and I'm going to be kicking off some questions, and then we're going to leave some time at the end for your questions as well. And I always say that we want to be prompt with our appointed officials and also the career staff, so they know that we're very efficient here at BMA, so they keep coming back.
Thank you.
So again, I just mentioned, obviously, CMS started open enrollment last weekend, so I did want to lead with a question in that space. And also, again, BMA's focus is working with our allies and beneficiaries. So Kathryn, if you could just tell us a little bit about what Medicare beneficiaries can expect this year as far as their benefit offerings and the premiums, and then what you see as some of the important changes in them.
Sure. So as you mentioned, we just started open enrollment, and in my house, October 15th has a special meaning because it's the birthday of my firstborn son. So despite the fact that I get excited about open enrollment starting, he's excited about the fact that he just turned 18. So, but I think it's important, first of all, to acknowledge all of you and the work that you do. It's so critically important to know that we have this legion of people out there helping beneficiaries make plan choices that are right for them. I know over the course of my mini 25-year career at CMS, I've gained a lot of different perspectives from the places I've been. Sometime in the regional office, we're working with beneficiaries firsthand. So we all bring our perspectives and our experiences to our work each day. But I also approach my job as a daughter of a beneficiary. So my mom is 87. She's legally blind and has been for most of her adult life, and in the last 5 years has been diagnosed with dementia. So, there's a lot of challenges, and I think that many of us bring those perspectives to our work each day in thinking about the beneficiaries that we serve. And Medicare Advantage plays an important role there, and we're really excited that, this year, once again, the program is very stable. There are a lot of plan choices out there. The premiums are stable. Just about 100% of our beneficiaries have access to at least one plan across the country, which is really exciting. And as I think you all had mentioned earlier, and the administrator mentioned, premiums are at record lows, and that there's so many important benefits that come along with Medicare Advantage. But we really need to be mindful of choice making and how difficult that can be. For all the people that we serve, whether they're in rural areas, whether they're isolated from their family members, community-based organizations like many of those that you all bring to the table here play a vital role. And so I think it's really important that we continue to reach out and make inroads and improve our outreach and our support for people who depend on all of us to help them make those decisions.
And Kathryn, just as you speak to the stakeholders here, is there anything that you would say to them that they should be doing, or information that they should be focusing on to make sure that they're sharing with beneficiaries as they're making these choices?
Sure. We've done a lot of work, not me personally, but in our Office of Communications to enhance Medicare Plan Finder. So I encourage all of you to take a look at that. There's a lot of features that have been added in the not so distant past. We have more information on there about choices beyond Medicare Advantage. We've added information about Medigap, premium information there that wasn't previously available. And we continue to, adapt and improve that site. And so we've made tremendous strides at making it more personal and really understanding exactly the choice decisions that people are making. What are they looking for in coverage? What's important to them? Is it, capping out-of-pocket costs? Is it low premium? Is it low copays? Really diving in and getting more personal information would be the ultimate goal, I think, of our agency in using those tools in the most human-centered, design-focused way that we can. But I would encourage you to take a look at it and try to experience it from the eyes of a beneficiary. And we're always open to suggestion and working with others about new ways to enhance the tool and the features that it provides as we make those important healthcare decisions or help others make them.
Thank you. Just shifting gears from open enrollment, we're still always evaluating post-COVID, but it's never not a COVID period or not a post-COVID period, and we're always evaluating any kind of public health emergency place that we're in, and unfortunately the one issue that we're always needing to focus on are mental health services, and CMS continues to play a leadership role in that space. What is CMS doing to improve access to mental health services when it comes to public health emergencies? And then, as far as mental health services for Medicare beneficiaries within Medicare Advantage, how can Medicare Advantage care coordination models be leveraged to deliver that high quality model and integrated mental services within that effort?
Sure. Mental health is clearly top of mind, I think, in all of the decision making at the agency, and certainly from the administrator on down. We've been encouraged to look carefully about ways to support access to behavioral health services. And, I know personally for me this morning, it's the first time I've been in person at an event in almost 2.5 years. It's weird, right? We're all digging out of our caves and putting on clothes and trying to resume normal life. But to be honest, it's very important, I think, to all of us as part of the agency's effort to expand mental health. And I think Medicare Advantage is uniquely situated in the emphasis on care coordination and working across provider types through that coordinated network. At its most perfect level, there would be integration among providers discussing what's going on with an individual, making sure that providers are screening when you come in for primary care visits, make sure they're screening their patients for mental health issues as well as physical health issues. They're uniquely situated to, I think, have those conversations when you have a relationship that's effective with your primary care provider, and translating that information across the care continuum is critically important. So I think you'll see probably more emphasis on that in the coming year. How do we make sure we're doing everything we can to bring mental health awareness and behavioral health issues to the top.
Thank you, Kathryn. Another timely place that we're in is related to the marketing materials that seniors are beginning to see, and also the calls that they're getting. And again, we want to applaud CMS, for the increased oversight of those materials, including requiring the greater transparency of the third-party marketing organizations. What additional steps is CMS taking to ensure that people with Medicare have accurate materials? And also, how can Medicare Advantage plans partner more with the administration to make sure seniors are getting clear, understandable information?
Sure. I mean, I think as I mentioned earlier, and others have said it as well, is it's really important that we make sure people that are guiding our beneficiaries, really understand the program and have their best interests at heart. I mean, the goal of the program is that beneficiaries make a plan choice if they decide that's the right path for them, that suits their healthcare needs, and that's the main focus is for these agents and brokers or whoever it might be that's assisting individuals and enrolling in a plan. Has the best interests of the beneficiary they're assisting at the core. We are very concerned with the marketing, and we will continue, as we always do, to monitor that during the open enrollment period. And I think, as we work to support and get back to the community-based one-on-one counseling, that we can hopefully help the state health insurance programs that assist beneficiaries and other community-based, faith-based organizations that work in the communities directly with beneficiaries. I hope that whole foundation that we've built can be more supportive of people as they make their plan decisions during open enrollment. It's critically important. At the same time, we have to make sure that plans are accountable for the agents and brokers that are selling for their plans. They are ultimately responsible for making sure that they're acting appropriately and not inappropriately enrolling beneficiaries in plans that they didn't want to be enrolled in. I think we all want to minimize that. That's very disruptive to people and very confusing to them and to their family members. Sometimes they don't understand what's happening and they don't know where to go for help. And so I think the more we can get the message out that we are here working alongside you all to make sure that the plan choices make sense, and that when something happens that needs to be corrected, that they're steered to the right place to get that information and get into the plan that they needed to be in or intended to be in from the beginning.
Well, thank you. And we just had a call last week with Ms. Seshmani, the head of Medicare, and it was Greg Gear, our head of policy and research, and obviously the marketing was one of the areas that we had discussed, and just again, whatever we can do, and we had shared this with Mina to partner in that effort, and we have obviously a lot of allies in that space, and we know it's a responsibility on all of us to make sure that the information is clear. So however we can be a part of sharing that information, to please let us know.
Sure. It gets complicated, right? As the system and the world kind of expands and there's different ways to reach people, it makes our jobs that much harder in understanding exactly, tracing back what happened. It's not necessarily just one individual, right? It could be they entered through a website and they got a call back and they didn't anticipate that. And so trying to kind of unwind exactly what went wrong at times can be very complicated. But I think working together, we can make a lot of progress in trying to get back to where we, I think, need to be in terms of helping people get into the plan that's best for them.
Thank you. We heard the administrator in her video speak about the pillar of health equity, and in my remarks this morning, I spoke about the convening that we had on health equity that several of our allies were at, and know that this is a priority of this administration, the secretary, and your whole agency, and know that there's going to be a lot of progress there. We were so pleased that Dr. McKeever, the head of your Office of Minority Health, spoke at our health equity convening. And as you have made reducing health disparities a priority, can you speak to what CMS is specifically looking at to further advance health equity for people with Medicare, and also how Medicare Advantage can be leveraged to further advance progress in this area?
Sure. I think the pandemic laid bare a lot of health inequities, and I think the administration and the administrator is very interested in helping us all to view our work through that lens. It's a very important aspect of what we do, and I think in the Medicare Advantage space. We've done a couple things in the last year that are, I think, speak to that issue in terms of making sure that individuals receive information through that, what we refer to as a multi-language insert, but making sure that everybody understands that translation services are available, that information they need in their native language can be made available to them, making that an easier process, and making it at a point of emphasis and importance for all of us. We also implemented the screening for social determinants of health through the dual-eligible special needs plans, which I think is important to make sure we are identifying barriers that those people might have accessing care, whether it be transportation or meals, or just special outreach in a different way to encourage them to seek appropriate healthcare services. Those are all small moves, but I think in every aspect of our work we're asked, what is the impact of this decision on equity? And so it's definitely top of mind for the work that we do across the board, and making sure we're thinking and doing everything we can to reduce barriers to care, whether it be through language or disability access. So I think you'll continue to see a lot of emphasis on that, as just like behavioral health. It'll be one of those things that continues to be at the forefront of all the work we do.
Thank you. I think I have time for a question before we turn to the audience for a few questions. And I'm looking at those watching time, and it looks like they're agreeing with me. I didn't want to go without being able to bring a question related to the Inflation Reduction Act, which I just want to say thank you to everyone in the agency for the passage of that act. I think for those who have worked in government, it is a daunting task to be in an administration when there's a piece of legislation passed that you may not have anticipated, and all of a sudden, not only is it a new piece of legislation, but you're all of a sudden, the passage is the task of then the execution of it. And it's done in record time, and the leadership of the administrator, and we, again, on this call we just had with Mina, they did it not only in record time, but with the risk that they realized that they needed to be able to do it in the context of realizing enrollment was around the corner, and a lot of other timelines it needed to be done so beneficiaries would be able to start seeing some of the changes, but that not all of it would be able to be done in a perfect way, that there weren't some outstanding items, but you can make perfect the enemy of the good. And so they took those risks and worked very, very closely with all the partners involved and engaged and got input. And we just literally had a call with the administrator and Mina last Thursday, where they're continually getting feedback and on the guidance and continually making changes. But they got it out in record time, as they committed to, and are continually addressing changes and improving. So with all that said, thank you for being a part of that effort. And so with that said, what do you see as some of the most important changes that are critical to beneficiaries as we move into this enrollment period?
Thank you for that. Yeah, we're very excited about the changes that are coming. It's a little bit daunting, but truly it's, I always say public service really is an honor, and we're here to serve the American people, and there's no greater opportunity to do that than to put together and implement something new and exciting, and it's important to the American people as this Inflation Reduction Act work is for our agency. So thank you for giving me the honor of being able to do this work. It's really exciting to be part of it. Yeah, it's a lot of work. There's a lot of short deadlines, but we're very excited to bring the cost savings to beneficiaries and to communicate that clearly. But it takes all of you too, to make sure you're up to speed on what's going on, and that you're also providing feedback to us. That's very important, that we understand the decisions we make have to be implementable by the industry that we work with, and sometimes time is short, but we really do our best to take in your input and be thoughtful and mindful of the impact of our decision making on the people we serve, but also the people who help us serve those people. So I think last week we held our first, we call it the user group call, which is kind of a weird name. But it's just a standard call that we used to do during the implementation of Part D, I think is when we started doing them. So we've upped that process, and it's an opportunity for the planning community and others to come to us and ask questions, and it helps us, if we don't know the answer, to know that we need to be thinking about something. Perhaps we weren't thinking about it, perhaps we have been and we're not ready, we haven't made our decision yet, but we appreciate those opportunities to engage with stakeholders, and so we're excited for the new year. Fingers crossed, we're working hard, everybody's really engaged. CMS is full of tremendous people who are not only really, really smart, talented, but really, really committed and dedicated to the work we do. So looking forward to it.
And as I had mentioned on this call with the administrator and Mina, we are looking to get on our calendar a webinar that will focus on the IRA and what we as partners can do in getting information out on how the provisions will impact the MA beneficiaries, and Mina shared with us your education packet, but again, anything that you have that we can be able to share to complement what you all are doing.
Great. Yeah, I mean, I think, the message is clear that we're excited about, lowering drug costs and insulin, all those great things that are on the horizon. It's very exciting, and we look forward to continuing to work with everyone to communicate that important information to the people we serve.
All right. Thanks so much. Let's give Kathryn a round of applause.